you guys can hear me, so I'm gonna wait for that. And in the meantime, I'll review the beginning portion. So we have a pretty long presentation today, and I want to be able to get through all of the information. And so I have a few introductory slides. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. And so this is an example of the few things that we are able to provide. And a disclaimer, so we are in conjunction with SAMHSA. All materials appearing in the presentation, except that directly from copyrighted sources, is public domain, and it may be reproduced or copied without permission. Citation of the source is appreciated. And we just, a few more things. Myself, I am the presenter, I'm sorry. Essentially, give me 1 second. Okay. Okay, so essentially, my background is in social work. I do have an LCSW-S, which allows me to do therapy and also allows me to supervise other people who are seeking, trying to get my thing here, seeking clinical supervision. So my background is working with families. I've worked in medical social work, crisis response, school social work, and as an individual therapist. Currently, I work for UT Health for a program called TChat. It's a very new program. We were actually created before the pandemic to be a virtual program, and so all of our services are shared through telemedicine. And just a declaration of no conflict. I have no conflict within this present, no conflict of interest in this presentation. So we'll move a little bit forward. So learning objectives. So today we're going to discuss and identify how 2020 stressors have impacted youth and family health. We're going to identify some basic cultural considerations and mental health factors for the Hispanic and Latino youth and family. And then we want to learn a few brief stress management tools that can be utilized to manage stress. Now, my background in doing this presentation and at my portion within MHTTC is on the school-based side. So a lot of my interventions are school-based, but they can be done in other agencies or even at home if you have little ones that you want to help out, or for yourself. So we want to take a brief look at 2020. 2020 was an extremely stressful year. I'm just going to go through a few of these things. I've done this presentation before, and it can get pretty heavy just looking at what we've been through within the last year. It seems like such a long time ago, but it is still pretty fresh. So in January, we kicked off the year. I guess we were hoping it would be a good year. And then a pretty well-known celebrity athlete died. A lot of people were able to connect with this celebrity, felt attached to this person, and so the grief started the year. And it was a tragic death. So in February, we had talks of the new virus, and we also had Ahmaud Arbery, the murder and the killing of Ahmaud Arbery hit the news. And then in March, we had this disruption. That's where a lot of this disruption patterns started with school. A lot of schools decided that it was not healthy to continue school in person, but they weren't too sure what to do. We also had work disruption. So we started working from home with no clear plan of when we were going to return. Breonna Taylor was also murdered in March, and so the news of her death has hit back to back with Ahmaud Arbery. Toilet paper craze started happening, and so we started to see a panic in just basic needs. In April, schools and workplaces started closing indefinitely. And then in May, we in this, then the world really were able to view the death and the murder of George Floyd. And so back to back was the televised protest, the unemployment rate shot up, and then we had additional killings that we were able to view on TV. At this time, we did have everyone at home with a lot of idle time. And so the police brutality and the tragedy and the social media sharing of videos, viewing of videos, and the trauma associated with it shot up. And then we just go through the year just very disconnected to what our reality was. We weren't too sure what was happening, when we were going to go back to school, what school or work was going to look like. And so we had family units that were just completely stressed. Then in about October, I know at least I'm in Houston, Texas, so at least for Houston and in Texas, we were trying to work our way back into the school system, but not really understanding how that would look. And then throughout the entire year, we were unsure of how to celebrate holidays. And with Latino families, we are a very communal population. And so not being around families, not being able to celebrate religious or cultural holidays was a big disruption. So that's 2020. And so we had a lot of things going on for our kids. How can you be ready for school when you've just experienced a lot of these things? And so we had vicarious trauma. Fear of COVID was really relevant because no one knew anything about it. Because of the increased time at home, we had video and screen addiction. Video games have been a huge thing with our teens. Of course, stressed out parents, unemployment, sleep disruption. Our sleep patterns were completely disrupted. We had to kind of go on survival mode, and that looked different for everyone. Nutrition disruption. I know I had a lot of friends who were complaining about how many snacks they were buying at home and how there was an increase in grocery costs. Peer rejection fears. I know with the kiddos that I've treated, we had a lot of stressors related to, are these people even my friends anymore? I haven't heard from them. I don't know what to expect. When I do go back, when am I going to go back? If I go back, will my peers still accept me? Increased isolation. There was an increase in domestic violence cases. Lack of basic needs increased. And then we go on to another list, lack of routine, ethno-racial trauma, a lot of moodiness, depression, anxiety, emotions were roller coasters, irritability and anger with parents who were just stressed out, not sure what to expect, not having the typical coping skills. We can't really get out of the house. We can't engage in things that we once upon a time engaged in to cope, whether that's, going to the park, going to a concert, going out to eat, things like that. Toxic stress went up, and we'll go over that a little bit later. And then the feelings of being unsafe. We did see an increase in regression, specifically bedwetting, which was interesting, and lack of social rewards for teens. They didn't really know how to act because they were used to engaging in school and receiving that social reward or social acceptance. And then as we went through the year, we had a lot of school avoidance. And so specifically for the Hispanic, Latino, Latinx community, I will use these terms interchangeably, but they each have their own meaning. They do present with a collective population, as a collective population. So what does this population look like in the United States, and why is this important? So according to the recent census, there's 328 million people in the US. So about 60% of those people self-identify as Hispanic or Latino. And honestly, it's really about self-identification. Some people identify, some people don't. If we have people who are coming from other countries who are new to our country, they may not even know what the term Hispanic is, because that was a term that was created for the census in the 1970s. So they may identify by their home country. There is expected to be a rise, significant rise. And so by the year 2060, there's an expectation of 30% of our US population will be of Hispanic, Latino, Latinx descent. Some cultural considerations that we'll review sprinkled throughout the presentation. Literature has documented a set of characteristics that are shared by most Hispanic, Latinos, Latinx population. One is the Spanish language. Now, Spanish language is not the only language for Hispanic and Latinos, but it is a majority language. Personalismo is huge. So personal contact, positive rapport, formal friendliness. When establishing care with someone of the Hispanic or Latino population, being personal is pretty big. Establishing personal contact and not overstepping boundaries, but just establishing that positive rapport and that showing of caring, kindness, formal friendliness is important for the community. Now, that was disrupted by COVID because a lot of things were no longer in person. And whenever we start using telehealth and we start using programs that are just virtual, we lose some of that sense of personal touch, personal contact. Familismo is huge. And so familismo is basically the collectivism, the unified support, the idea that a family or the community is important. And that was also disrupted, right? And so familismo could look something like your small group in church, something that is very familiar, very comfortable to you. And now you can't go to church in person. I know, just for an example, when I was growing up, we went to Catholic church, and my grandmother was really, really big into serving and volunteering within the church. And so she had a group, and they're pretty well known, the Guadalupanas. They're just small groups in different Catholic churches. I believe it's around the world. And they will make food when a funeral happens and serve at the funeral. They'll do different activities within the church. And so things like that were disrupted. That unified support, that collectivism, that community was disrupted because we couldn't do things like that during COVID. Respeto is respect given to professions and authority figures. And then we have machismo and marianismo. So these were affected in different ways, which we can go over later. But machismo is essentially the manliness, the protector, the provider. Now, machismo gets a bad rap because of the negative connotation to the word. A lot of people will use the word as this person's being machismo. He's being kind of overbearing. He's being kind of a sexist type of persona. But in reality, machismo means someone who is essentially supposed to protect and provide for the family. So the father of the family, the guardian. And then marianismo is essentially the opposite. So womanliness, nurture, sainthood. She is not supposed to do anything wrong. She's not supposed to be seen in a light that is compromising. And so with the nurturing aspect of it and the connection in schools, the way we saw this was the mother was at church. I'm sorry, was at the school. The mother was attending a lot of these things in present in the schools. And so with telehealth, it's a little hard to manage those roles, the gender roles that are pretty central to the Latino community. And I want to move on to COVID stats. So as you can see, this is per the CDC. The Hispanic and Latino population is second in each category and shows a very high risk for infection, hospitalization, and death. This was actually updated last month. So we still remain at a high risk in all categories. And we're only second to the American Indian and Alaska Native, so the indigenous people of our country. And so contributions that contributions to the increased rate. According to the CDC, the following impact rates for exposure to COVID. So we have many inequities in the social determinants of health that put racial and ethnic minorities, in at increased risk. So we have discrimination, which includes racism, and this can lead to chronic and toxic stress and shape social and economic factors that put some people from a racial and ethnic minority group at increased risk. Toxic stress, we will go over later, but toxic stress can also present as intergenerational trauma. And so when we look at the history of our country and the oppressive laws and things like that, we are not far from policies and things that were put in place just within the past decades. Regarding access to healthcare, people from some racial and ethnic minority groups are more likely to be uninsured compared to the non-Hispanic white counterparts. It can be limited in groups who have obstacles of transportation, childcare, the inability to take off work, communication and language barriers, cultural differences between patients and providers, and historical current discrimination in the healthcare system. So that puts us also at an increased rate. If we're just looking at communication and language barriers, if we cannot communicate, if we're not insured, then how do we know the risks that are associated with COVID? If we can't take off work and we're surrounded by people all day, then of course we're at an increased risk. So we go to the exposure in the workplace, which is very real for our Black and Brown communities. So people from some racial and ethnic minority groups are disproportionately represented in the essential work settings, such as healthcare facilities, farms, factories, grocery stores, and public transportation. So there is a high exposure rate there was a high exposure rate when COVID started and even until now. Now there are a little more safety precautions. We have standards, the staying 6 feet away, the wearing the mask, things like that. But we still have families who were unable to dodge that. They weren't able to work from home. And then when you have workers who are essential workers, and just say a city bus driver, someone who is working in a school or a hospital as a custodian, then their exposure becomes the household exposure. And so housing puts us at an increased rate too. So some people from racial and ethnic minority groups live in crowded conditions or multi-generational households that make it more challenging to follow prevention strategies. So although we're outside of the home and we're staying 6 feet apart and we are wearing our mask whenever we go home, it looks different. In some cultures, it's common to have family members of many generations within the household. It's not common to have our elderly in nursing homes. And so we also know that the elderly population was at an increased risk as well. And then we had some concerns and fears for undocumented families. So we had financial instability. And for example, I have a family member who is undocumented and who works as a domestic worker. She's a maid, and she has her different clients, and she was unable to go into the homes and work and at least for a few weeks until the county decided what they needed to put in place. And so domestic and restaurant workers, especially restaurant workers, were unable to work. And then they didn't have any stimulus support. They didn't have an unemployment benefits that could supplement the income that wasn't coming in. So there was no access to that financial support. Unsafe work environments. There were employers who were directing workers to leave after curfew. So for those counties that put in curfews, for whatever reason, at the time, of course, we didn't know what COVID what was happening with COVID, and so some cities or towns or counties put in curfews, and some employers directed them to stay until after the curfew. And that's a huge safety risk for the undocumented community. So fear of driving during shutdowns, communal restrictions. We couldn't go to church. We couldn't go to any of the local community centers that we typically enjoyed going to and received social support from. We had families who were caregivers for the elderly, and they were not able to go into the homes or visit them for a while. And then a decrease in college and university motivation of undocumented students. So we have a population of undocumented students who were graduating last spring and who may have been excited about going to college, but now, and in Texas, we do have state financial support for our undocumented students. But when your family is suffering and you need to help bring in financial support, then you're entering the workforce a little earlier, and your plans have to go to the side. And then I want to touch on this a little bit. The distrust of medical resources or community resources. So we have, for our undocumented populations, there's typically a distrust of any community support. If you have to give too much information, then it could be a risk to your safety, right? So I know with our program is all virtual, and we do ask for some information, but we're a bridge to care program. So we provide brief intervention for 2 months, and then we help the families connect with a therapist and a psychiatrist. So we provide that intervention while they're waiting to get into somewhere else. And so when we were helping a lot of undocumented families get connected to care with our community agencies, county agencies, who I completely apologize for that. County agencies who do service our undocumented populations, they did not want to fill out the paperwork. There was a huge fear of tracking and tracing for them. So there was a lot of hesitancy and a lot of fear associated with that, but the care was needed. Not only was medical care needed, but mental health support increased. The need for mental health support increased in 2020. So moving on to the next portion, the medical experimentation in communities of color. So the U.S. has a history of using communities of color and minority populations as projects for medical experimentation. So just to name a few, we have the infamous Tuskegee Project, where for 40 years, from 1932 to 1972, the U.S. Public Health Services conducted experiments on African-American men who suffered from syphilis. So the U.S. Public, this is a government agency, U.S. Public Health Services lured men with the prospect of free medical care and meals, but withheld treatment. So as a result, hundreds died slow, painful deaths. And so when we think about the vaccines that are being offered and the experimentation with the vaccines last year, that caused a lot of stress. For communities of colors who were aware of these medical experimentations on our populations, but also on the dominant population or the Caucasian population who didn't quite understand, why some people were hesitant and who were distrusting of the U.S. population. So the next one, sterilization of women. So this was an experiment that was used as a means to control quote unquote undesirable populations in California. And so actually California was one of the bigger, had the biggest negative effects, but it was in different states. So there was a project that wanted to control immigrants, people of color, poor people, unmarried mothers, and the disabled and mentally ill. So in the 20th century, there was a federally funded sterilization program that took place in 32 states. This led to the sterilization of 20,000 California men and women. It was a 70-year project. So from 1909 to 1979, this project lasted. And the people did not have full knowledge or consent of this. And so we think of 1979, that really wasn't that long. I was born in the early 80s. So to me, that wasn't that long ago. And then last, we have the most recent case where there was a discovery of forced hysterectomies at Irwin County Detention Center in Georgia. So these women were receiving hysterectomies without their consent during their time in the detention center. And this was in the past few years. So there was a high distrust of medical resources and medical experimentation, especially when it came to the vaccine. And we want to move on to mental health. So within the Hispanic and Latino community, there are some common beliefs and experiences with mental health. So this is pretty common amongst everyone, but within the Latino community, we tend to express our mental health, I guess, our mental health concerns with body pain. So stress and depression looks like backaches, headaches, stomach aches. And as we know now, that's very common. And then we have fatalismo. So this is a common belief that troubles may be attributed to moral conflicts, guilt, shame, over poor judgment. So it's simply just fate. So a lot happened in 2020. And prior to 2020, this may have been something that a family believed in. But 2020 was so packed with trauma, so packed with stressors, to continuously tell yourself that this is fate, this is something that God wants, can be overwhelming and extremely stressful. And then when experiencing mental illness, it can be common for Latinos or Hispanic populations to seek spiritual healing or other healing as a first step. Now, with the churches closed, and typically other healers may look like something like curanderas, where they do different ceremonies or traditional things in person. That also stopped or had an increased risk when seeking care through another type of healer. And then to move on, more like Hispanic and Latinos are more likely to seek help from a medical professional and not a psychologist or psychiatrist. So there's a huge stigma around seeking mental health support from a mental health provider. A lot of Latinos will just honestly say, well, they would rather go to the church than go to a therapist. A lot of them will go to a medical professional to seek assistance versus a psychiatrist who's specialized. And most likely to do so from someone they know as well, such as a school or a teacher or a longtime family doctor, someone they've seen for generations. And commonly overlooked mental health barriers include lack of mental health providers. So the 11 and 5%, 11% is the amount of mental health therapists and clinicians that are of Hispanic and Latino descent, right? And so 11% is very small compared to the amount of Latinos and Hispanics that we have in our country. And then the 5% is associated with psychiatrists. So there is only 5% of all the psychiatrists that are Hispanic and Latino, that are of Hispanic or Latino descent. So when looking for a provider that looks like you have a very low chance to find someone. And on top of that, we have all these other providers, but they may lack culturally tailored services or culturally competent mental health services. And so they may work with dominant populations who are okay with not really being around communal situations or having a lot of social support from churches or padrinos, madrinas. And so when we look at the Hispanic and Latino family, it is more unified, and there's a lot of different layers in there. And so if you're working with a mental health provider who does not have the competency, they may miss a lot of things or misdirect the treatment process. And then there's definitely a shortage of bilingual or linguistically trained mental health professionals. There's lack of access or fear of care for the undocumented community. And then, of course, there's still a cultural stigma associated with receiving mental health support. Down here, this is a really good book to read to almost understand the stressors of a young Latina navigating her way through the US. It's hard to explain without giving too much of the story, but this was written by Diane Guerrero. And Diane Guerrero was on Orange is the New Black, and she's an immigrant advocate. Both of her parents were immigrants, and she had a long and traumatic journey as a child and a teen, just navigating mental health, being in Latino population, trying to find providers who she could relate to. And so it's just a good book that I always suggest when trying to understand the stressors and mental health components of a Latino or Latina. And then this is very important for me to share. This is a common survey that was completed in 2017 that shows that Latina teens have a high risk of suicidal thoughts and attempts. So we cannot discount this and how it relates to 2020 as this it has increased. And as the Hispanic and Latino population continues to grow, the rate of depression, anxiety, suicidal thoughts, suicide attempts among Latinas, young Latinas, may increase as well. So they do remain above those of Latino male youth and white males and females. And so we'll take a look at this slide really quick. As you can see at the top of the top graph, these are Hispanic / Latina women between the grades 9th grade and 12th grade. So they have the highest percentage of those who have seriously considered suicide. And then if we look at the second graph, same grades, 9 through 12, same population, Hispanic women, they also have the highest percentage of those who have attempted suicide. And so when we're working in schools or working with young populations, it is very important to have true cultural competency training when it comes to the Latino, well, of course, all populations, but the Latino and Hispanic population, as it does affect our youth in different ways. And then last, privilege can create conflict in mixed status families. So what we saw in 2020 is an increase in stressors as related to this. So we have documentation status, am I able to seek resources? Am I not able to seek resources? So mixed status families mean that there are some people in your family who are undocumented and some people in your family who are documented. And so a clear example would be both parents and the oldest brother are undocumented and they do not have citizenship. However, when the parents came over to the United States, they had 2 younger daughters, and so the 2 younger daughters are citizens. And so there are certain privileges that a citizen has versus someone who is undocumented. And it could look like these different areas. The most important one being the sense of safety and deportation fears. And so we want to move on to the emotional backpack. What are we all carrying? What did we carry over from 2020? So there is this term, you may have heard of it, the emotional backpack, or emotional baggage is the more, I guess, popular one. So this is just a metaphor for all the stress and high emotions that we carry around with us. And if we're thinking back to the calendar of 2020, it was like every single month, high emotions, high emotions, high emotions. And it was really hard to come down and to plateau off of those emotions because something was always happening. And we're still not over it yet. And so I want to take a look at a few foundational theories, foundational just terminology that have been disrupted and how mental health effects and challenges have been incorporated into just our daily lives, what kind of things were affected by this. And so in the social work, psychology, counseling field, where we should all be very familiar with Maslow's hierarchy of needs. This was created by Abraham Maslow. He was an American psychologist and philosopher, and he argued that each person has a hierarchy of needs that must be satisfied, ranging from basic physiological requirements all the way up to love, esteem, and finally self-actualization. A lot of us in social work and psychology or the mental health field kind of work from this theory unconsciously or consciously. So we want to explore how these have been disrupted. And we look at the bottom and we have food, water, warmth, and rest. When I see that, I think of the news story, and of course I'm in Texas, so it's more relatable for me, but sometime last year, I think it was during the summer, the food banks in San Antonio had a huge line for hours and hours and hours of people just waiting for food. And then we move on to safety and security. And that was directly related to COVID-19 and how secure are we in our own house now that we're having to stay home all the time. So which levels were abruptly interrupted in 2020? This was not something that was phased out. It was something that was more or less abrupt. Our patterns changed, our place of worship changed, our work changed, our place of work changed. For kids, the school changed. And so for me, I look at the level 4 school-based setting, and I just want to review that for now. So the first level in the Maslow's hierarchy of needs that was disrupted was this red level down here, the physiological. So the first one includes nutrition. So for school-aged kiddos, generally they can receive breakfast and lunch at school. So that's 2 meals a day. And so now, or when the pandemic started and there were no in-person schools, nutrition was disrupted. Sleep was disrupted because prior to virtual school, typically had a sleep pattern. Go to sleep at 8, you wake up at 7 or something like that. When we switched to virtual school, it was almost free for all, right? And so when I started seeing teens in our program this year, in this school year, we had a ton of sleep disruption. We had a ton of kids who were up all night playing on video games or using screen time. And so sleep is very important, and we'll go over it later of why it's important, but the sleep pattern was disrupted. So kind of looking a little bit into it, when we have routine, when we're in school, we're physically in school, we have a certain routine. The school offers some type of safe shelter, right? And so with that comes a routine, which include bathroom breaks. And so what we discovered, at least within my practice and practicing with little ones who were having regressive behavior and the bedwetting, a lot of it had to do with no routine. And so for some kids, just having a bathroom break at school was, their mind telling them that they are safe and they're not doing anything wrong. And now we're at home and we're having this regressive behavior and the self-esteem is affected, and it's just a chain reaction. And if we want to move up to safety, we have safety in a school building for the most part, security and knowing that you were going to be fed at school, security knowing that there were a ton of adults at school. Some kiddos who had parents who were essential workers still had to go to work. They were at home alone. And then just kind of moving up a little bit, the gray portion, love and belonging. We have hugs and high fives by teachers at school. We have social interactions with friends. We have basic conversation with different people. And so that allows us to get that the different chemicals released and have that socialization, have those social rewards. A lot of kids suffered through the isolation when they went home. And then the blue is the self-esteem, achievement, and status. So we get social rewards at school, reinforcement by peers and teachers, praise. So for kiddos who were getting in trouble a lot at school, they may have done better in virtual school, but for the kiddos who need praise and they need that social reward, they really suffered through it. And all of this is important for our children's health and well-being, but also for their development. So that was completely disrupted, abruptly disrupted in 2020. And then moving on to racial injustice, the impact of racism on mental health. So 2020 was a year that allowed for more focus on racial injustices in America because we were all sitting still. We had an opportunity to watch what was going on and become aware of what was going on. It was very hard to ignore some of the things that were shared on social media, that were in the news. The injustices are not new, but our children and teens have not experienced this amount of attention on racial injustices in America in their lifetime. So 2020 forced most people to pay attention like they never did before. Thinking of 2020, we acknowledge the victims, but unfortunately, we also were able to see the victims die preventable deaths. And they were viewed on social media and television, which is very traumatic. So these are cases that some of our children were not able to avoid. Some of our children may not have had the privilege of not paying attention. They may have connected to it way more than others. Some of our children and families have been triggered and re-triggered by hearing racist comments. If you're looking on social media, you're going to see them, and having their feelings invalidated by people in the community. Whether they know them or not, it's still an invalidation. So these families may have experienced this over the summer, but they return to school and work with these effects. One client of mine, I saw him, I want to say in November, and he was a young African-American child. I want to say he was about 12 or 13 years old. And we talked about his worries. He had a lot of anxiety, and he literally said back to back, I'm worried about school. I hate taking off my mask because I'm super scared of coronavirus. And all I want to know is, are people still killing Black people? And that hits hard, right? Because how do you address that? This is what he has seen. Everything, the safety, the security of wearing that mask is important to him. He's completely terrified of coronavirus because he mentioned that every day his mom was getting a notification that someone in the school had coronavirus. And then on social media, he's able to see what was happening to young Black men And he can completely 100% identify with it. And so this is his lived experience. And then we go to ethno-racial trauma. So the definition is the individual and or collective psychological distress and fear of danger that results from experiencing or witnessing discrimination, threats of harm, violence, and intimidation directed at an ethno-racial minority group. This is exactly what my young client was speaking of. He may not have experienced it directly, but he was witnessing it over and over and over to people of his same racial minority group. And this can also come in form of trauma that stems from legacies of oppressive laws, policies, and practices. How has this affected our families in 2020? Have we had a chance to stop and think of all the things? In 2020, we had an increase in anti-immigration rhetoric. We had a lot of DACA political conflicts, people going back and forth of whether they believe in DACA, whether DACA should end. Is it helpful? Is it not helpful? Why are these kids here? Things like that. Controversial topics of kids in cages. We were able to see an increase in Native American and Indigenous oppression, and there are high rates of COVID and not being safe. There were constant arguments, especially on social media, about police brutality. COVID statistics for our Black and Brown communities were much higher. There were arguments about Confederate monuments. And all of this is associated with ethnic populations and children and teens that may have been exposed to these discussions. So the exposure and the repeated exposure and the witnessing of the discrimination, the reading of the very harsh racist wording for some can be traumatic. So this can affect our psychological well-being and cause the overload of stress. This absolutely 100% goes into our emotional backpack. So as providers, as educators, as people in the community, as respectful human beings, we want to be mindful, like, what is our part in this conversation? To simply say, I don't see color is not healthy. And it's not validating. Conversations about racial injustice, are we having them? Are we not having them? This is not new for students. When I worked in the school setting, I had students come to me all the time saying, you know, I think this kid is racist. I think these teachers are racist. I think this was racist. And I would hear some colleagues, not all colleagues, but I would hear some colleagues, and not in a malicious way, but still in an effective way, say, well, oh, they're not being racist, or oh, that's not racist. And when I say in an effective way, I don't mean in a positively effective way. I mean that this affected the students. Hearing this invalidated what they were feeling. So are we allowing them to speak, or are we not allowing them to speak about all these things that have happened, all these things that they are seeing? Right now, we have the George Floyd court hearing going on. And so we're revisiting that. So it's important to be mindful of the racial and discriminatory statements that children and teens bring to you, right? Because it's kind of a test. It may not be an intentional test, but it is. They base their opinion of you off of how you respond. So if you are validating, what are you doing? Basically, when someone tells you that I feel this person is racist, they're essentially saying, I don't feel safe. So when someone says that they don't feel safe, how do you respond to that, right? You know, and what would be an example of being validating for them? You don't have to confirm or deny if someone is racist. You can just focus on how they feel, right? Like, what are you feeling right now? Have you ever felt like this before? What things does this bring up for you? How can we help you cope? How can we support you in healthy coping skills? And just be honest. If you don't know what to say, because you can attach to it. Just be genuine about it. They just want to know that you care and that you care that they're safe right now. And then in higher levels, it's definitely important to communicate with parents when you feel there is a concern or you want to offer more resources. So I do want to go into a few kind of biological things that are happening based off of all the stress that happened in 2020. This is a very wordy slide, but it's important to just kind of understand toxic stress. So toxic stress is basically an overactive stress response. So stressful events that are chronic, uncontrollable, and or experienced without support from caring adults. So we look at chronic and we see all of 2020 until now, uncontrollable, all of 2020 until now. And these are strong, frequent, or prolonged activation of the body's stress management system. So your body is trying to cope with this over and over and over again. There's two areas of the brain that are affected by this. So we have fear, anxiety, and impulse responses. So this is because of the overproduction of neural connections. And then we have the reasoning, planning, and behavior control that's affected because of fewer neural connections. In short, there's a lot of responses, but not a lot of thinking through the responses, right? It's just impulse, impulse, impulse. So extreme exposure can change the stress system. So prolonged exposure. So some of our kiddos were coming to us already with trauma and abuse and a lot of things that were going on at home, not having a healthy home. And 2020 increased that. And so our body responds at a lower threshold, meaning it's quicker for us to react, and it activates more frequently. And so a lot of tantrums going on. This is a study that was done, and it connects the toxic stress to intergenerational trauma. And so in 2013, there was a rat study that was done where they had male rats in these cages, and every time they shot out a cherry blossom scent, they had these electrical currents on their feet, and they would increase the current. So they would shock them essentially. So cherry blossom scent goes out and there's a shock. They did this for 10 days and then they bred them with females. And what they found was up to 3 generations, there's a sensitivity to the cherry blossom smell. So we have our grandchildren, right? So our grandchildren, the rats' grandchildren, every time they disperse that cherry blossom smell to the younger generations, their bodies were jumpy and nervous. They were no longer attached to the electrical current. That was only 3 generations ago. But they still had these reactors. And what they found when they dissected the brain was that there was a DNA gene that was encoded into the smell receptor. And this is why grounding is very important. Using your 5 senses in a healthy way is very important, which we'll go over later. But essentially, it's not that fear is being passed down to generations. It's the fear in one generation leads to the response and the sensitivity in the next generation. And so the fear is not being passed down, but it's still in your body. So toxic stress increases all of these things, stress, hormones and inflation, cellular aging and cortisol, and then it decreases neuroplasticity, which means it's harder for the brain to kind of learn how to rewire itself. And then the effects of cortisol disrupt sleep. It gives us more of those triggers for craving sugar and fatty foods. So when we look back on 2020 and how I mentioned my friend said that their children were eating them out of homes, they wanted snacks all the time. That could have been because of an increase in cortisol level. And too much cortisol is toxic for the brain. So it can result in a smaller hippocampus over time, which affects learning and memory. So we had a lot of kiddos starting school with disrupted learning and memory because of the toxic stress. the increase in cortisol, disruption in sleep. A really good book is The Deep as Well by Dr. Nadine Burke Harris. It's awesome. If you can find any podcast by her, completely awesome, and it helps us really understand toxic stress in the body. And then before we get to our tools, I do want to review sleep hygiene, super important, and then amygdala hijack, which are both important when trying to get our kids healthy again. So before we get to the toolkit, which I do have a toolkit ready for you guys, I want to go over these few things. So sleep hygiene, essentially, there's different cycles for sleep, right? We have to have a certain amount of sleep. Most people will tell you need 8 hours of sleep. For teens, we actually need 8 to 10 hours of sleep. And their sleep cycle kind of extends a little bit. And so when they're used to going to sleep at 8 o'clock, it kind of pushes, when they become teens, pushes back about 2 hours. And so their sleep time becomes about 10 o'clock. So sleep hygiene, one complete cycle includes 3 stages. So we have the non-REM stage and the REM stage. So one cycle takes about 1 to 1.5 hours, and it has to be uninterrupted. So we need between 4 and 5 sleep cycles for one fully rested night, and that equals about 8 hours. What's happening during these stages is that the uninterrupted sleep it acts as a garbage collector that comes during the night and removes all the waste product that's left in the brain. So it eliminates the toxins, it flushes out the cellular trash, it repairs the brain cell damage, and it's important for the physical and brain growth, right? It takes the time to go through and just cleanse the brain while also helping it to repair and to grow. So when we have those fully rested cycles, this process is allowed to happen. When we have uninterrupted sleep or shortened sleep, say the kiddos are only sleeping 3 or 4 hours, this process doesn't happen. So it leads to problems with language processing, behavior, mood, and cognitive performance decreases. Behavior and mood tend to be more irritable. Long-term memory cannot consolidate learned tasks from the previous day. So whatever they learned the day before is as if they've never learned it. They can't retain it. And then there is attention span is all over the place, and they have decreased reaction time. So this makes it depend more on the amygdala and the emotional reaction versus a logical reaction. And so we want to lead to the amygdala, which is the fire alarm. A lot of schools are really honing in on this, and I think this helps our students a lot. There is a video by Dan Siegel, and a lot of books by Dan Siegel, and there's different images of flipping the lid, and that's essentially your amygdala going off. And so when we look at sleep, if there's a lot of disrupted sleep, that amygdala is firing off. And so the way I describe it with my clients is that reaction of a bear walking into a room. So any little thing can produce a reaction of flipping the lid. And that's the adrenaline rush that flushes through your body. Your blood and oxygen push through, and it makes your feet and your hands want to fight, flight, or freeze. With that, our thinking brain kind of shuts down because all systems are not crucial in survival. We just need to run. We don't need to know how to compromise with a bear or anything like that. We don't have time to do any of that. Our body just wants to run. And so all of this, the toxic stress, the lack of sleep, leads to the amygdala consistently in this fight or flight mode. So if we look at it in a timeline, it's 2020, pretty much all of 2020, increasing the toxic stress. The toxic stress decreases the sleep, increases things like the fat accumulation, as well as the cravings and things like that. But it also creates more of an impulse reaction. and fight or flight reaction. Now, there is a way to reverse the amygdala. I promise we're going to get to the toolkit, but there is a way to reverse the amygdala, and that has a lot to do with something called the ventral vagal network, and that is completely 100% connected to deep breathing activities. And when we are able to practice the deep breathing and reverse the amygdala and attach to that ventral vagal network, it helps our hippocampus. So it helps file away memories as safe. It starts retraining the body to be in a safe, calm way. So I just want to go over a few things, learning stress management tools that can be utilized in a school setting. Time matters. So there is research that states that it takes about 15 to 20 minutes for us to go from that amygdala fight or flight brain back to calm, safe, logic learning brain. So coping skills and developing coping skills, we want to develop them for about 15 to 20 minutes, which is a long time in a school setting. Because if you're a teacher and you have a 30 to 35 kids in a classroom, 15 minutes is a long time. It takes 14 to 21 days to create a new habit, and research shows that it takes 68 days to rewire the brain. So if we can do a coping skill every single day, get back to the safe brain, then we can start to rewire that brain. So I want to go over just a few things: assessing basic needs, tuning into the body, connecting to 5 senses, exploring thinking and behaviors, and then using apps. If kids want screen time, let's use those apps. So these are a few tools that I'll go over when just doing basic assessments for need. Of course, we want to explore Maslow's hierarchy. Now, this is where we can truly get into some of the stressors that are going on with our kiddos or our parents whenever we see them in a school setting. You know, do we have the basic needs at home? Do we feel safe? Do we have concerns of coronavirus? What are some things that the school can help with when it comes to, you know, if mom lost her job because of the coronavirus and they don't have food, water, they don't have a good sleep routine, like what are some interventions that we can offer? Of course, now more schools are going back in person, so we have nutritional value in that. We have more water. Drinking water is super important. And then we move on to a few things. This one is the GAD-7. This is another tool that can assess for just the level of anxiety, right? And so GAD stands for Generalized Anxiety Disorder. This is not a way to diagnose. This is just a way to screen for symptoms that may be going on, right? So it's just a tool that's used as a check-in tool. Like, let's see where we're at today. What's our score today? Let's figure out what interventions we can do to help reduce some of this anxiety. So you'll be able to kind of get a sense of how much energy is in the body, so how much of that toxic stress is just kind of moving around. And it assesses for the last 2 weeks. You're not diagnosing, you're just using this as an exploration tool to find out what's troubling the student. And then just be prepared to have some additional therapy resources or psychiatry resources. If you can find resources in your community, now we have telehealth, so that broadens our base. But if you're able to find resources in the community of therapists who speak Spanish, psychiatrists who speak Spanish, or the common language that's in your school that's other than English, that's super priceless, super valuable to keep on hand. So just as the other tool, the GAD-7 explored for anxiety, this one explores mostly for depression. Again, you're not diagnosing, you're just trying to get a sense of what concerns there are. So if we're looking at just trouble falling asleep or staying asleep, okay, let's look at your sleep routine. Let's do some sleep hygiene education. Let's explain why it's important to have those 8 hours of uninterrupted sleep. Let's reduce the screen time before going to sleep, things like that. poor appetite or overeating. This will give you a sense of like, are they stress eating? What are some nutritious snacks that we can offer? There's a lot of lists that you can find just online of healthy snacks. Let's see, and then absolutely this one, thoughts that you would be better off dead or hurting yourself in some way. We definitely want to know if this is increasing and what we can do to provide interventions for this. Again, we want to keep that mental health provider list on hand at all times. And then exploring buffers. So this comes from Dr. Nadine Burke-Harris's work with ACEs, the Adverse Childhood Experiences. She talks about there are 6 interventions that can help reduce our overactive toxic stress response. And so as we know, the overactive stress response can affect energy, impulse responses, sleep disturbance. And so we want to address these small areas. How can we help our families? How can we be culturally competent when helping our families? What are some things that are helpful? And so we have healthy relationships, nutrition, sleep, exercise, mental health, so therapy, meditation, and mindfulness. It doesn't have to be the act of sitting and meditating, but let's walk outside. Let's get some fresh air. And then this is a great tool for to incorporate those cultural factors and kind of review if there are some cultural factors that are becoming an obstacle to care. So this is in the DSM-5. It is evidence-based. It's an evidence-based tool that's composed of a series of questionnaires that assist the clinicians in making a person-centered cultural assessment that informs diagnosis and treatment planning. So there's 4 domains in here. You can read through each one. So domain 1 is the cultural definition of the problem. And it makes a little more sense if you're able to get your hands on the full assessment. When I first learned about the CFI, it was really interesting because it's very close to a psychosocial. You're just adding cultural pieces in there. And you can find the interview online. You don't have to have the DSM because the DSM can be pretty pricey. So cultural definition of the problem. This domain seeks to incorporate the patient's own view and language of his or her illness. The question in this domain first inquire about the reasons for the visit, noting the person's understanding that may be different from the providers. So as providers, we have all these fancy terms and ways of saying different things. And this is a way to just get that person's view of what's going on. Domain 2, cultural perception of the cause, context, and support. So this aims to clarify what a person in his social network considered to be the origin of the problem. Now, with cultural competent language, cultural competent knowledge, you may become aware of different things that our patients are saying. So if someone comes to me and says, well, I think this is something that was a curse because of, you know, my mother-in-law's side of the family, and we just don't know what to do. There's nothing to do, right? The fatalismo part of it, this is just God's way of telling us X, Y, Z. So there is a cultural connection to that and an openness once you start understanding that factor of it. And then that determines that helps create the treatment planning and treatment process that help them buy into it versus just providing a diagnosis, goals, and a treatment. And then we have domain 3, cultural factors that affect self-coping and past help seeking. So this explores what a person has done in the past to cope by his or herself with the situation and to seek treatment or other forms of help. So did they seek out a local healer? Was a curandera involved? How did that go? Was that helpful for them? I have a student right now, she's 10 years old, and she went to a curandera, and then someone from her family gave her crystals. And she really believes that that helps, and it, you know, that's her belief, and we honor that. and it's important to the family. And then we just add coping mechanisms on top of that. There's nothing to get rid of. We're just adding other things. Domain 4, cultural factors that affect current help seeking. So this domain explores the person's preferences for future care as well as those of his social network. It also allows any concerns about the clinician-patient relationship. So this is a chance for them to express, like, do they think that therapy is going to work, and why not? Do they think psychiatry is going to work? Why not? And so it's a time to have a conversation. So those are a few different tools that just for exploration and assessment. And then we have the second set of tools for our toolbox is tuning into the body. So we're looking at that amygdala hijack. How can we identify when our amygdala, the fire alarm, starts hijacking our thinking brain, right? So in other trauma focused presentations, you'll learn that when your amygdala hijacks, your logic brain goes down. You cannot have both at the same time. They can't fully function. And so how do we get ahead of that? Let's do a body scan. Let's figure out like what's going on in the body that's not allowing me to think and cope in a healthy way right now. So when your amygdala goes off, when you have that fight or flight portion, the fight or flight response, quote unquote, the bear walks into the room, your amygdala sends a signal to release cortisol and adrenaline. So the heart pounds, the airways open, pupils dilate, blood to the big muscles for running and jumping, and then it turns the logic brain down. So there's little to no executive function, judgment, and impulse control decreases. So when the bear walks in the room, we tend to have this crazy image. I don't like this image because it makes my mind feel cluttered, but when we have anxiety, that's kind of how it feels. So when you have kiddos who are constantly in this state of heart racing, they want to run, their legs are shaking. How do we work with them before they have that response and they take off running out of the classroom or out of the school? We can teach them. And there's different worksheets. On Zoom, I literally just draw out a horrible outline, but the kids don't really care. They know what to do anyway. And we just ask them, like, how does your body feel anxiety? Oh, my stomach hurts. My legs start shaking. Okay, when your legs start shaking, let's try these activities. And so when we are in fight or flight, we want to try to safely engage in energy depletion. So fight or flight is typically your hand shaking, your leg shaking, and your body needs to do something with it. So these are just quick little activities that we can do. Honestly, adults can do them too, just to get that energy out. Our body just wants to respond. It thinks there's a threat and it wants to respond. And so this is a way to safely get that energy out. Belly breathing is another one. This is just the example, the explanation of how it works. But you can find many videos for adults, young ones, children on belly breathing. One that I really like to use is the birthday cake activity. So this is where a client imagines their favorite birthday cake or flavor. Sometimes I get them to draw it out just so that they're more connected with it. Let's draw, let's color it, let's put the candles on it. What do you hear when you're doing this? Who do you hear? Oh, I hear laughter. I hear someone singing. I see my mom. I can touch the cake, things like that. And then you have the client close their eyes and spend 4 or 5 seconds just breathing in through their nose. Oh, let's smell this cake. And then just breathing in, and then, okay, let's slowly blow out all of these candles. And you can get them to connect with that picture and do the belly breathing on their own. So connecting with that is activating that ventral vagal network. That ventral vagal network eventually connects with the hippocampus. It tells your brain that you are safe. So these are just biological things that are already in our body. They function this way, and we just kind of manipulate it to help our brains understand that we're safe. Toolbox 3 has the connection to 5 senses and grounding activities. This is a really common one. 5 things you can see, 4 things you can hear, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing that you can taste. So connecting and having present moment awareness can reduce that worry and future thinking. So if we have children who are connecting with a lot of the stressors from 2020, or we have Latino families who are worried about their parents being deported. They saw this on the news. They heard this on a social media post. And so we can kind of pull them back and just connect them with present moment awareness. And it helps reroute the brain from perceived threats to present safety. Takes a lot of practice though. So our goal is to get these kiddos to just do it on their own as much as possible. One way that I've kind of put a twist on this for my clients is I have them do a creative writing piece. I don't look at the way they spell words. I could care less about grammar. I just want them to write a story that incorporates their 5 senses so they can start understanding that their 5 senses are a safe place and a good way to kind of pull back and just safely distract themselves from whatever threat they're feeling. Now, if they can use present moment, they can use what they're seeing, what they're feeling, what they're thinking, fantastic. If they can't, then they can identify a character and have that character, use that character and write a story about what the character is seeing, hearing, tasting, smelling, and touching. This is an example of one of my clients, what they wrote. They identified a lady named Mrs. Grape Juice who was at home and she lost her crayon. So we identified a character and we had a problem. And so what was she going to do? She had to take a journey. Okay, so what did she look like? She put on a purple dress, she had purple lipstick, she had purple hair, and she started walking to the store and imagining the crayons that she lost. So they were yellow, blue, green, and red. And as she walked, what did she hear? She heard birds chirping. The birds were chirping and singing a happy song. She walked by a bakery and she smelled these delicious cookies. Her favorite cookie is chocolate chip. So she went inside and she tasted the chocolate chip cookie. It felt warm and gooey as she tasted it, and it made her feel happy and calm. And so we're using these words that were positive and in a positive light to connect to our 5 senses. And then our last tool is using technology. A lot of these tools do have a Spanish version, and so it's very helpful to share these with the families and kind of show them how to use it. So these are extra tools, extra apps. And I'm going to go ahead and stop right there. I do have some additional slides that we can that you can review on your own. I put them in there just in case I ran out of time. But the most important thing would be the end, and it's really just understanding. Building relationships, of course, is important, but we're trying to get those 2020 stressors. Of course, our Black and Brown communities have higher rates than other communities. Our Indigenous populations have higher risk, higher rates. And so that means our amygdala was kind of set off the entire year. And so we're working to just reduce that amygdala using culturally competent skills, finding out what works for families. And so building relationships, really focusing on that personalismo. And of course, we all know therapeutic rapport is super important. And then I believe we have a survey that we will need to get to. I just want to make sure I don't run out of time. So if everyone can do the survey, and I will hand it back over to Cindy or Isa to close out. And I thank you all for attending.
Thank you, Danita. We don't have any questions at the moment. I don't know if the audience might not know how to submit questions. On the control panel, you have the question tab or the chat tab. You can write in either of those and we will receive the questions. And I also had some people asking about the handout. You should have a tab that said handout as well, and you can download the PDF and the slides on that handout tab. And I just sent the link for the survey as well on the chat, just so that that's easier for everybody. So I don't know, I'm gonna wait for a couple of minutes to see if someone submits a question, and if you wanna say something else.
I do want to say I couldn't see myself the whole time, so if I look crazy, I'm sorry for that. Usually I can see on Zoom. So I talk with my hands a lot. So.
We can see you fine. Sorry about that. Oh, we do have a comment. Let me see. It says, I really enjoyed this. I work in a Latino community and we are having a great increase in suicidal youth, and this was very helpful.
Yeah.
And then I think this is a question. Oh, go ahead, Danita.
No. That is a common. Unfortunately, there were higher rates pre-COVID with our Latino and Latina youth as well.
Thank you. The question says, how receptive are the Latino students to mindfulness exercises?
That's a really good question. So mindfulness can be used in different ways. And I think what some people get stuck in is using the mindfulness skills as is, right? Like we get this sheet of paper or worksheet or instructions on something. Being flexible is very important. Letting them create their story is very important as well. So when creating stories, I know with my, I see a lot of Latina teens, right? I work a lot with children and teens, but my population love working with teens. And so I see a lot of Latina teens. And incorporating it into their world is very important. So when I show them something, I try to say, okay, like, how would you use this? What are we thinking of? And so they will picture like their quinceañera. They'll picture what dress that they're going to have on, what cake they're going to have. And so when we're connecting to five senses, it's okay to completely let them connect in their own way and just reroute them. When they start getting into that, well, what if this happens? And what the worries start popping up is pulling them back, and really just explaining what present moment awareness is. It's literally just staying in our present moment, like present joy, present happiness. Utilizing stories is a little more of just the imagery part of it. But what do they have at home? What is something during the day that they really enjoy? Well, I really enjoy coming home and my mom cooked. Okay, tell me what that smells like. Tell me what you see. Tell me how that tastes. And so really connecting with their world is important. And so I do that a lot. I think with teens overall, they sometimes they're like rolling their eyes at mindfulness, like, oh yeah, I've heard this before. My teacher talked about it, but I don't really know how to do it. I've never tried to do it, or my brain doesn't sit still for that long. So it's really helping guide them through that exercise, but also connecting it to their world and their culture. And if you're not familiar with their culture, of course, I'm Latina, and so I have more of an advantage. But if you're not familiar with the culture, it's just really training yourself to become a part of their story, right? If they're explaining what their parents' food tastes like or smells like, it's, you become a part of that, and kind of modeling like how that can bring them joy and safety. The most important piece is just that safe brain. And then just explaining, like, we just need to do this 15 to 20 minutes a day, every day. practice this. And what will happen is they start doing it on their own whenever they need it. I hope that helped answer the question.
I think it did. Thank you, Anita. Our next question says, if you can talk a little bit more about working with kids virtually.
There's actually a slide that I didn't go over. So virtually, there's so many advantages and disadvantages, right? So see if I can share this. I don't know if I'm still sharing my screen, but school-based mental health is, there are some advantages. So with families who lack transportation or lack time, we're able to connect with the kiddos and do therapy with them. And we're able to talk to the parents more, right? Because we're almost, going into their home, going into their world. And so we've seen, it takes time, but we've seen an increase in, or let me back up. We've seen a decrease in that cultural stigma, right? One, because they see I'm a Latina. Two, because it's not as nerve-wracking as going into an office. And so in that way, it's been an advantage. Now, things that we have seen within our Latino population, more of the non-English speaking population, is it's harder to get them set up through telehealth services because of lack of internet, just lack of understanding of how to work, the Wi-Fi. Of course, their kids are helping, so that's helpful. With kids being on telehealth for a year now, they're more versed in how to get on Zoom. They know how to do these things. Some families who are new to the country may not have an email address. And so we're seeing some obstacles in that. And so you're gonna have to take a little more time connecting with them. Sometimes it's contact. Now, if you're a program, our program we're contracted with different school districts, so we're able to talk to counselors. But if it's a sense of like, is there somebody at the school that you can talk to that can help you with this? Is there a secretary or a counselor or a school social worker that can help walk you through this over the phone? That's helpful. But with telehealth, we have our advantages and disadvantages. Another disadvantage is that the students are just tired of Zoom. They're completely zoomed out, but they're also able to avoid. And so it's really working with that. Like, okay, you don't want to show your face in the camera. What else can you show me? Are there some things in your house that, that bring you safety? Are there some things in your house that are triggers? Let's learn how to work through that. And then patient privacy. So with some Latino families, what you'll notice is there's multi-generations in a household. And there's, there may not be as much privacy as we would hope. And so it's really talking to the families in the beginning to really get them on board with this patient needs privacy. This is what confidentiality means. This is the state law on confidentiality. We want to make sure that the student is super comfortable talking to us. And so it's really getting them on board. And then I would say with my Latina teens, if they need a medication evaluation, that is another obstacle that I have noticed the difference between telehealth and in office. In office, it was a little bit easier to connect with the parent, walk them through it, and almost like convince them like, hey, let's just try one visit with a psychiatrist to see what they think. Doesn't mean you're confirming that you'll take the medication, but let's just see kind of where this goes. Whereas telehealth, there's a lot more opportunity to avoid. Like, okay, well, we'll do it later. Okay, well, we'll do this. And in office, you can hand them paperwork, you can draw pictures, things like that. On telehealth, you're like, okay, I'll email you these resources. These are some doctors that you may want to visit with. some psychiatrists, and then they hardly get back to you. So I think it's still that cultural stigma. So taking baby steps when it comes to telehealth. It's still enjoyable, but it's a little more steps to take. I'm trying to see the questions, but I can't open the box.
Thank you, Anita. We do have a couple more questions, but I want to be mindful of the time for everybody. So I don't know if you want to share your email or some way they can contact you for that.
It was at the very end. There you go. That's just danitagallegos@gmail.com. That's the easiest way.
Awesome. And if you want to say something before we close.
Just thank you. I know this was a long presentation with a lot of information. It's really hard to narrow down what is relative to 2020 because we had so much. So I just hope that it was helpful.
Well, thank you, Danita, for an excellent presentation, and thank you everybody for staying. Now a couple of folks stayed for a couple of minutes more, so thank you everybody. You'll be receiving an email with the same survey link, and those of you that asked about CEUs, it's very important that you fill out that survey because that's where we get your information for the CEUs. And with that, I think we can say just have a good day. Thank you, everybody.
Thank you.